Hey guys, I'm Dr. Jared Williams. I'm your third molar expert, and I'm super excited to make this video. So, if you're a GP who's wanting to take your skills at next level, or you're a patient that's just like, hey, I'm having a paresthesia, which means numbness in my jaw, what do I do? Then this is the video for you. All right, guys, welcome back. I'm super excited for you all to come and watch this video. The last time I made this video like this was about a year ago at about 5,500 views, 22 comments. And the thing is this, I wasn't necessarily too concerned with the views. I was more so concerned with the number of patients that was messaging me about their traumas after third molar surgery. So as a third molar expert, I've completed over 12,000 cases. I work with several offices here in Houston. And as I continue putting out information specifically for GPs to learn how to do third molar surgery, I saw that there was a tremendous amount of docs that were reaching out to me asking me for help. But the reason why I wanted to make this specific video is for the patients out there who are being treated. Now, I want to let you know, disclaimer, doing a surgery can have a tremendous amount of consequences, such as bleeding, swelling, infection, numbness, and even death. All right. Now, typically, you don't see the death part and the numbness too frequently in majority of surgeries, but I want to let you know those are things that could happen. And so when I train GPs to do third molar surgery, I'm giving them everything they need to know in order to be successful, just like myself. And I would say this, you don't complete 12,000 cases without having any type of complication. But then in addition to that, you also don't get to this point and have patients respecting your work and doctors respecting your work and training other specialists to do these types of procedures without understanding and actually following principles when it comes to third molar surgery.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now and let's embark on this exhilarating journey together.
So I'm super stoked because today I'm going to address a couple of concerns, but then in addition to that, I'm going to share with you, maybe on the next video, how you can literally contact a oral surgeon who is also a microneurovascular surgeon that specialize in this specifically, so that you can understand the steps you need to take should you have had a altered sensation or something wrong with your jaw that was be deemed, hey, this needs to be taken care of. So in this particular video today, I'm going to address a couple of concerns and comments in this video. All right. So let's jump into it. All right. So in this video that I made before, it says how to manage patients with dental paresthesia 3 weeks after. So I was looking at a couple of these, and I'm going to zoom in on it so we could be on the same page. So this patient said burning pain. So KL-T7HB said burning pain at the extraction site of a wisdom tooth in my cheek. Started 4 weeks after my surgery. That's interesting. Okay. Oral surgeon was at a loss, didn't really care, and told me if it was nerve damage, I'd just be numb. It is so painful at times. Now, when I first read this, I didn't see started at the 4 weeks when I thought I replied to it. I guess I didn't. Well, here's your reply. So it is common to have, it's not uncommon to have a paresthesia when you're going through third molar surgery, right? Anytime you're working with the nerve, there's going to be some type of paresthesia. When I train docs, I always tell them, hey, when in doubt, after you get a CT scan, if the tooth is not coming out, just go ahead and do a cornectomy. A cornectomy is basically where we just take the crown of the tooth and we leave the roots in there intentionally. Two things typically happen. One, the root will just sit there, won't cause you any issues, or over time the root will work their way out and Caesar just plucked that way. And so that's a simple, straightforward process of a cornectomy. All right, it has some techniques that it's technique sensitive. So if your GP wants to learn it, we have some information that you could take your skills at next level, and so that would be an option for you. So with that being stated, having pain and burning at the extraction site 4 weeks after, that's really, really, really odd to me, because typically if you have something such as a nerve injury, you're going to start to see it and feel it within a short time frame, especially after the local anesthesia or the numbness has worn off. Typically, if it's 4 weeks after, that would kind of be a little bit concerning. I will say this, typically when you do a surgery, especially around wisdom teeth, you're removing bone, or there could be bone that has been displaced. Typically what happens is how bone operates, it takes a long time for it to remodel. And sometimes if the nerve was entrapped, right? So here's a bone and here's your nerve. Let me grab a pen. Nerve. And what happens is if there's a lot of trauma, the nerve could be pushed behind the actual bone and there could be entrapment. And when that squeezing happens, that's when you could start feeling these types of sensations. So it could have been that when the doc was doing the surgery, the nerve could have been entrapped like this, opposed to being on the outside. So this is entrapment, and this is where the nerve should be. And typically that happens when bone is remodeling, but it's kind of odd that you'd have the burning sensation and it happened 4 weeks after. One thing I'm a little concerned with is this. If it were an oral surgeon or a GP or whomever, when they say it was a loss and didn't really care, hopefully that's how you felt, right? And hopefully that's how you perceive the scenario. Now, I'm not gonna disregard your feelings, but my hope is that the doc didn't actually intend to feel that way. Simply because that would really suck. And I would never want my family members to have gone through a surgery and their doctor's just like, whatever, it's on you. So my prayer is that because you were having this burning sensation, if you didn't hear what you wanted to hear, which is perfectly fine, they came off that way. And I'm hoping and praying that they didn't, because if they didn't, I have some ammunition that you could use to facilitate that they will never use that towards you again. All right. So that's my prayer. I'm praying that you received it that way and they didn't do it. But what we're going to do is we're going to get you through this process. So he or she said, didn't really care and told me if nerve damage, I'd just be numb. Now that would really suck. I'm hoping you interpreted that way and they didn't hear it that way. So with that being stated, couple things that should happen when you're doing any type of surgery. And when I say any surgery, I'm talking about any surgery. I always talk about principles. You want to be given the pros, the cons, and alternatives. In the event that the doc didn't give you the pros, the cons, and alternatives, and you were clear on it before you get started, then we have some challenges. Anytime I do surgery, if I don't have a patient that's 100% on board with anything that I'm doing, guess what? I am not treating that patient, period. I don't care how easy, how lucrative, how quick the case can be. I'm not touching that patient, because anytime you do surgery, it's not just, hey, I'm going to be doing the surgery and then you're going to be sitting there and doing nothing. No. It is a team approach. So hopefully this is the doctors that you'll come in contact in the future. For all you doctors like, hey, how do I learn more about this? Click on the JW method so that you can take your skills at next level, or join our next 5-day challenge so you could understand the principles of third molar surgery so you could not have something like this happen. So it's unfortunate it's so painful at times. So I will say this, there's a couple things that you can do, and this is 5 days ago, so you're probably at the five week part. All right, so since I wasn't going to cover this in this video, but I'll go ahead and jump at this now just for the sake of time And it's probably when this video comes, it may be a little later. So, what I want for you to do is this. I want you to go ahead and Google microvascular reconstructive surgery, and specifically with oral surgery. So I'm in Houston, but I just went ahead and I just Googled this, and this is Stanford medicine, right? And so just kind of give you an idea of what you're going to be looking for. You're probably going to be looking for a doc who is an oral surgeon that focuses on micro neurovascular surgery. And in this scenario, okay, good. So they said we were proud to offer comprehensive multidisciplinary program in the head and neck region. So reconstruction of surgery, our program brings together experts in reconstructive surgery, speech and swallowing therapy, nutrition, oral surgery, which is good, prosthodontics to help maximize your quality of life before, during, and after treatment. So perfect. These are the exact people that you would have called a call. So in this particular situation, what you'd want to do is call them, and I'm going to end up making another video on what this call actually looks like because I don't want this to be too long. Right. And the questions that you should be asking them, I just got off the phone with a doc out in Texas, and I asked them, what is a typical cost for a procedure such as this, for reconstruction of the nerves? And that nerve is this right here. Let me zoom in so you can see it. So typically when you're doing a surgery, you have a third molar that the roots, which are right here, extend past this part. And this is a nerve, right? And what happens is when this roots are taken out, this nerve is like cut, compressed, or just completely ripped into two. When that happens, it's kind of like you go to your light and you cut off the switch and there's no light. That's the same thing with the nerve. When you cut that nerve, there's no electricity that's going and there's no signals. And so what they're to do is they go to connect those two pieces. So when I contacted the doc that I'm referencing, just want to give you some costs here, some rough costs. In order just to do the graft, that's about $2,500. That's just their part of the surgery, right? And then you have to either go get a cadaver or they'll actually harvest it from your arm, right? And so those prices start to go up and up and up. And so you're typically going to see this procedure done out of the clinic. So anytime it's out of the clinic, I was speaking to one doctor in particular, they said that this is not insurance at all. So that should let you know that this price is going to go up and up and up. So the reason why I wanted to give you this information, number one, as a GP, is so that you could see this coming down the pike. If you have a patient who you're planning on doing third molar surgery on and they're not 100% bought into your procedure, say goodbye. If you are a patient who is about to get this procedure done, make sure you know your pros, your cons, and alternatives, even understanding what's going to happen if you have any nerve disturbance. Now, unfortunately, the person that we're talking about right now from this video, KLTL7HB, we're almost at that 5-week mark, right? Because they told me 4 weeks after, then 5 days later. This video is probably going to pop up in the next week or so because we have so many that we post at a time. It's going to be unfortunate. That may be to the point. But for all those patients that are having these procedures done and we're at that 5-week mark, 5 weeks, you want to make sure that you're getting in to see your doctor for post-op, which it seems like KL did, and then staying with them so that they could either chart your process as you go. All right. So I wanted to make sure that we're on the same page here. Like I said, I'm not going to make this video too much longer. I want to ensure as I plug my phone in, my computer in, so this video doesn't get shut off, because I know you are taking notes. I want you to understand that time is of the essence and follow-up is of the essence as well. So I want to make sure that you have everything you need in order to be successful. If I got out of order or anything, that's why there's a rewind button. Just go back and watch this over again. But I wanted to make sure that KLTL7HB really had an understanding of what's actually going on and what could happen, and then what's the next steps to doing it. And on the next video, like I talked about, we're going to tell you the exact steps that you should take, and I'm going to let you listen to me speaking to the doctors, office managers, so that you kind of get an idea of what is the time frame, what you should expect should this be happening to you. All right, guys. So once again, I'm Dr. Jared Williams. If this video was a blessing to you, or you felt that, hey, man, this is you, doc, you have a very humanistic approach, It was pretty interesting. Read that in the comments. Hit the likes button, smash subscribe. I don't want to ask you to do anything unless you have gotten extreme value from this page. Outside of that, remember, what looks hard is often easy. You have a phenomenal day. Make it a great one.